Okay. Okay, guys. So I am audible. Okay, guys. So let's quickly start with the questions. So I'm sure all of you would have done great in your exams. So. Wait. Okay. So this time, I think CET question was in pathology. It was quite simple, and I'm sure all of you would have seen my tentative or guess questions which I had posted over the past 2 days, and I'm happy to hear from you all that many questions came from that PDF and Instagram and the Telegram groups, the images that I posted. Thank you so much for all that. And I'm so happy order of draw came. I'm so happy aspergillus came, mucor came. I'm so happy the immunofluorescence came. So, and I'm so happy the electron microscopy of hairy cell leukemia came. So thank you so much, guys, for leaving me, and it has been a great journey. Hope to see you all at AIMS soon. So let's go to the question number 1 on the screen. Anti-apoptotic. So which was anti-apoptotic marker? Quick, guys. So this is all of you know that BAD and Puma are the sensors, so they are pro-apoptotic. Back channel is a pro-apoptotic channel, so definitely MCL1 and BCL2 are anti-apoptotic molecules. So the answer to this question was pretty simple here. That is MCL1. Okay, so just a sec. See. So the answer to this question was MCL1. Going to the second question. Just a sec. Screen is some issue with my screen. Okay. Right. So let's go to the question again. Right. So coming to the question number 2, which is true for necrosis. All of you know, whenever we are talking what is true for necrosis, what happens in necrosis is that your cell membrane swelling occurs, the membrane ruptures occurs, and it incites inflammation. So that's true. So cell membrane swelling. Okay. Okay, so cell membrane swelling occurs, membrane rupture occur, and it incites inflammation. So all these are true. It's the multiple choice answer. So I'm sure all of you will be able to were able to answer the question correctly. Right. So let's go to the next question. Okay. Question number 3. So colon tumor was integrated with surgical. Okay, so to make a diagnosis of colon cancer, what do you need? Everybody knows this, that we all will be needing a colonoscopy. We all will be needing CET and CEA. So, okay, CA99 is not used. This is basically a marker for pancreas. Okay, so this is a marker for pancreas. The other options were correct. So this is A, B, and C. Right. Good. Let's go to the next question here. Okay. So when we go to the next question, so next question was blood banking. So you have to tell me the storage timing, guys. Okay. So if you look at the storage timing here, guys, what was it? So FFP, guys, you have to remember the time here was wrong. Okay. So here the timing that was kept for 2 to 3 years, it's wrong. It is kept only for 1 year. Okay. Platelet is 20 to 24 degree, that is room temperature for 5 days. That's correct. Cryo, again the year duration was given more. Okay, so this is also wrong. And RBC 42 days was correct. It can be kept in 42 days in SAGM, but the temperature has to be from 1 to 5 degrees centigrade. Okay, so it is not minus 15, 5 to 15. That's wrong. So the answer to this is platelets, right? Okay. So this is your platelet, 20 to 24 hours for 5 days. That's the correct answer here. Okay, so today we're just going to discuss the answers quickly so that it is a quick recall. And There's no much wastage of time. Detailed discussion, we'll do it later. So what is true for BRCA? Okay, again, it was a multiple choice answer. So yes, so everybody knows that it is a tumor suppressor gene. That's correct. It is associated with Anthony, correct. It is associated with ovarian, correct. It is usually not associated with colon cancer. So option A, B, and C are true, right? Okay, let's go to the next question here. Okay, so what is the order of draw? So guys, I posted a video day before yesterday, and I'm sure all of you would have remembered and seen that. And I told you the code also that you have to remember for this. Remember the code, okay? That is very, very important. I've told you CCSHE. Okay, so that is first is always culture, then it is citrate, which is blue, then it is serum, which can be red or yellow, and then it is heparin, which is green, and then it is EDTA. And the last one is F, that is fluoride. I told you if something comes in last, that's fail. Fail is the last option, that is fluoride. Okay, so that is the option that you all have to remember. Okay, right, perfect. Yeah, right, guys. Let's go to the next question. So this also I had posted yesterday. If you guys have seen the post that I posted yesterday. So this is typically, so some people told me speckled came. Some people told me this was the image. If this was the image, guys, this is a centromere pattern. Okay, so this is not speckled. This is centromere. Okay, so you can see that bright dots coming in the center. That these are centromere. Speckled is very, very small. It's like dust particles spread all over. So speckled is immunofluorescence, which is most commonly seen because it's most non-specific. Okay, so here you can see discrete dots which are coming. So it's a centromeric pattern. Okay, so it doesn't look like that. Okay, right. Okay, so that was your centromere. It's not speckled. Okay, so this is not speckled. This is centromeric. Speckled is like, I had posted a image on the stories of the Instagram yesterday. You can go and see both the images. I've just not put them together. So speckled is just centromere. Speckled is like dust particles, small dots all over. This is definitely discrete centromeres which are getting highlighted. Okay, guys, right. Am I audible, guys? Yeah, right. So if there is anywhere where the video gets stuck, please let me know, guys. So this is about iron deficiency. Okay. Is the presentation moving? Yeah. Okay, so multiple options. True about iron deficiency. Guys, I've always told you a story on iron deficiency, and I've always told you iron deficiency is like a beggar, okay, who's a true beggar, who doesn't have food to eat. So everything is low. Only thing is he has high capacity to have food. So he's searching for food everywhere. His capacity for food is increased, definitely. So remember, whenever we talk about iron deficiency, so ferritin is reduced, iron is reduced. Even when there's no iron, there will be no transferrin saturation. But because he's a very, very, hungry beggar, okay, so definitely he's searching for food everywhere. So your TIBC levels are very, very high. So that is also true. So all the options that are given here are true. I think it was a multiple choice answer. So you have to remember. And this is what distinguishes anemia of chronic disease or anemia of inflammation from iron deficiency. Remember, anemia of inflammation is a rich beggar who has no desire of earning or eating food. So his TIBCs are very, very low. As compared to iron deficiency, he's a true beggar whose capacities to eat food is very high. So that is why his TIBCs are very high. Okay. So let's go to the next question now. Okay. So this is an image. Okay, so I had posted this image, I think on the Telegram quiz a few days back. So this is typical hairy cell, guys. So whenever there was a hemat quiz, this is one of my favorite electron microscopy image. You can see these hairy projections which are coming out. Okay, so that's a very, very typical electron microscopy of hairy cell. Okay, Gotchas will not be like that. Gotchas will be like something like this. It will have a lot of membranes inside, so it will not be like this. Okay, so definitely this image is of your hairy cell. Gotchas image I had posted on my YouTube revision session, short INICT revision session on my YouTube channel, where I had posted Gotchas. So if you know that this is a hairy projection. This is definitely hairy cells, guys. Okay. Let's go to the next. Arrange the steps in karyotyping. This was a tricky question, and I didn't expect this question to be asked for undergraduates, definitely. But they asked this question, right? Okay, so if you look at this, okay, right. Okay, So if you look at this question, guys, just a second. Yeah. So this was your steps in karyotyping, which was asked to you. And this was a question which I didn't expect for undergraduates. So remember, what do you do in karyotyping? I'll just tell you quickly. So you take a sample first in heparin. That's correct. After taking in heparin, you have to put it in the carbon dioxide incubator for approximately 3 days. Okay. So this is carbon dioxide incubator. That is step number 2. Okay. Where you keep it. Okay. So that, this one incubation. Only after that you will add colchicine. So step number 3 is that you add colchicine. Okay. After this, you will centrifuge, and after centrifugation, multiple steps of centrifugation, you will create a cell colonies. That is number 4, and the last step is staining with the giemsa and seam. So that's the array. That's the order. That's the step for karyotyping that you have to remember, right? So first heparin, incubate in carbon dioxide incubator, then colchicine, then colonies, and then giemsa. That's the order. Okay. Now, this was another question, which was a very easy question. Basically, if you apply your logic, DNA sequence alteration can be seen. Any technique which can see DNA can see the DNA sequence alteration. Okay, so Sanger is a PCR. It's a PCR technique which is based upon DDNPs. You add DDNPs and stop the process, so you can see any sequence alteration. Restricted fragment length polymorphism. Again, any insertion or deletion or single nucleotide polymorphism creates a restriction site which can be identified on your RFNP methodology. So it also identifies your sequence alteration. Fish, definitely it is seen to mean see the genes, whether there is a deletion, whether there is a fusion, whether there is a, so you use fusion probes, you use break apart probes to study if any, any translocation is there or any deletion is there or amplification is there. So any DNA alterations can be seen by any of these 3. Flow cytometry usually do not study DNA sequence alterations. Okay, so usually flow cytometry is meant to study the proteins. Okay, so it sees the antigens, antibodies, not the genes. Okay, so of course it was a multiple choice option again. So Sanger, RFLP, fish, all of a DNA sequence alteration. Flow is not for this. Okay, right. Let's go to the next question, guys. Okay, so thymus gland forms a protein which regulates the function of T lymphocytes. So guys, all of you know this is nothing but what are they going to ask is central tolerance. So which is the gene which gives central tolerance, and all of you know this is IR gene. Okay, so this is an autoimmune regulator gene which kills all the self-reacting T lymphocytes. So this is a type of central tolerance which occurs in thymus. Okay, so that was IR, right? Now, clue cells. So this is a very, very simple question again. What is a clue cell? It is a very scoring question. All of you know, clue cells are nothing but they are your epithelial cells on which the bacilli are stuck, and all the margins of the epithelial cells are stuck with the cocobacilli. So definitely it is an epithelial cell where the cocobacilli are stick to it. Okay, so that is your, yes, that is your this. Okay. Okay, Satvik, even if pyrosequencing is there, it is also a method of DNA technology only, DNA sequence alteration only, which you can be seeing it. Okay, so pyrosequencing depends upon the pyrophosphate groups. Okay, so it's basically, it gives light signaling when a pyrophosphate group is incorporated. So fine, that also, it can even identify very small changes or even in a sample which are contaminated samples, you can see DNA sequence alterations in pyrosequencing. So whatever is it, the logic of that DNA question was to just identify, do you know which is the technique for proteins and which is the technique for DNA? That was a simple logic of that question. Okay, guys. Okay. As an undergraduate, they do not expect you to know too much. They just want you to know basic things. That's it. Okay, right. Okay, so that was clue cell, which is pretty simple. Okay, SRI-Y gene. So this was, if you've seen the image, you will not forget it. Short arm of chromosome number Y. Okay, so remember, SRI region is typically present on the short arm of Y. So this was just a one-liner question. So if you have seen this, you will not forget it. SRY is present on the short arm, and name itself says short arm of Y. Short arm of Y. Okay, so if you have seen it always, if you have learned this by trick, you will never forget it. It's short arm of Y. Okay, that is SRY gene. Right. Let's go to the next question here. So match the following. This is one of the so this time I felt INSET didn't had much PYQ questions. They have a lot of new questions also, but this is a PYQ. Okay, I am sure all of you would have answered this. This is a previous year asked question, and it has been asked so many times. You all know Kaplan is described in cold workers. That's correct. Mesothelioma can be associated with pleural effusion. Silicosis usually give you crazy pavement, and asbestosis usually lower lobe is involved. So I am sure all of you would have marked it correctly. It was matched the following. I just kept the random options. So Kaplan is cold worker, mesothelioma pleural effusion, silicosis crazy pavement, and asbestosis lower lobes. Right. Okay, this was PYQ. I am sure all of you would have done it right. Okay, this is also a PYQ, and I'm sure all of you would have done it correct only. So once you see smudge cells on the peripheral smear, what are you going to do? You know, once you have smudge cell, this is probably CLL, and you have to do a flow cytometry to see if these cells are CD5 and CD23 positive. If they are 5 and 23 positive, your diagnosis will be CLL, and you can go ahead. So that is perfect. Once you see smudge cells, lymphadenopathy, you have to go ahead and do your flow cytometry. Okay, guys, let's go to the next question. So patient is on dialysis. Which type of amyloid? So there were 3 questions on amyloid, guys. So patient on dialysis, all of you know, I've told you the story also for this. So beta-2 microglobulin is a big protein, can't pass through dialysis filter. So the amyloid which gets deposited here is A beta-2. So full name is A beta-2 microglobulin. Okay. So that's the amyloid which is deposited here. So that is a simple thing. Yeah. Okay, next, go to next. So this was a pedigree which somebody has sent me, and they basically asked what is the inheritance pattern. So guys, if you look at this pedigree, this is a very typical thing that you see. What is this? That more than 50% of the generation is involved here. So if you look at this, the 50% generations are basically involved here. So what is happening is, okay, so even though all the generations are involved, this is like something like autosomal dominant pedigree, okay, but so you can say that this might be, ma'am, autosomal dominant pedigree. Why not? All the generations are involved. Yes, more than 50% of the every generation has the disease. Perfect. So there was another option which was given here is pseudo-dominant. Okay. So what happens in pseudo-dominant inheritance is that this occurs because of recessive alleles, but more than 50% of the alleles are affected. So normally in autosomal recessive, what is going to happen is only 25% of the progeny is going to get the disease. Okay, but what happens is this is this is a pseudo-dominant. That means it is actually a recessive inheritance, but it is behaving in a dominant manner. So this is what is called a pseudo-dominant inheritance. Okay, so what happens here is, so usually what they should have done is they should have kept this. They should have shown you this as a recessive partner. So whenever one of the partner is having a disease, okay, so you do not know that this is probably due to autosomal dominant disease or this is due to autosomal recessive inheritance. You don't know that, okay. So you suspect that this patient is having disease. Either both the alleles are recessive and that is why the patient is expressing, or this has a dominant disease, right? Now, if we are talking that this person has a recessive allele, and if both are recessive and if the partner is also inherited in a recessive manner and 50% of the progeny is involved, then this is a pseudo-dominant inheritance. Then this is the pseudo-dominant inheritance. Okay. This partner does not have the disease because he is a recessive allele and because it's a recessive allele and it's not expressing the disease. But if it is only a recessive inheritance, 25% of the generation should be affected. But because 50% of the generation is getting affected here, this is basically behaving in a pseudo-dominant pattern. Okay, right? Everybody clear with that? So this is what is called as a pseudo-dominant inheritance. Again, if you look at this here, always the catch is 50% of the progeny should be affected. So this is the affected parent and 50% of the progeny is affected. Again, here is a parent and 50% of the progeny is affected. Here is the parent and 50% of the progeny is affected. So this type of inheritance, where 50% of the progeny is getting affected, might be a pseudo-dominant inheritance. Yes, somebody might ask you, ma'am, can it be a dominant inheritance also? Yes, it can be a dominant inheritance also, but this pattern that only 50% of the progeny is getting affected every time doesn't hold very true with this. It is very difficult to differentiate pseudo-dominant from the dominant inheritance, and for that you have to do haplotype analysis, okay, which is a genetic testing. That is what you have to do. Okay, so that is why the possibility of this being pseudo-dominant is more than dominant. Okay, so I don't say that cannot be a dominant inheritance. It can be, but because that 50% of the progeny is coming every time, and if this was the exact pedigree that was given, then I will give pseudo-dominant as a more probable option to dominant, right? Okay, right. So that is your pedigree question. Let's come to the next. So complications of TACO. This is just a complication of massive transfusion, guys. All of you know that. Okay, so hypocalcemia usually, hypocalcemia doesn't occur usually, right? Elderly patient presenting, again, that was a repeat question, okay? So this was also elderly diabetic patient with immunosuppressive state showing oval budding yeasts. And whenever you see this one line, pseudo hyphae, so budding yeast with pseudo hyphae, this is nothing but Candida. So apart from this, there were also fungus option. They will also septate and aseptate fungus, which was asked, which I had also asked you, given you as an image. So they were septate. Septate acute angle branching was your aspergillus, you know that, and aseptate, okay, 90 angle branching was your mucor. Okay, so these were also questions that came. So I just put them together. CD40 is absent on the cell. What will not happen, guys? You remember CD40 ligand is present on the T cells and CD40 receptor is present on the B cells, and this signal is called as competence signal. Okay, so what is the signal called as? This is called as competence signal, because only after this signal, only after you get this signal, the IgM antibodies further change into all the other types of antibodies, that is G, A, and D. So this is called class switching. So if this signal doesn't happen, class switching doesn't happen, and this is one of the major pathogenetic mechanism behind hyper IgM syndrome. And there was also a flow cytometry question on hyper IgM syndrome, which was a repeat PYQ, which was asked, and we have discussed it so many times. So this was just a altered way of giving you a PYQ. Again, this was a PYQ. So what will not happen if CD40 is absent? Obviously, class switching is not going to happen. Let's go to the next question, guys. So on light microscopy, a pic was given, and this is the pic that was given probably. Okay, and this pic had some deposit. This color is a very typical color. Always remember that orangish red color is also called as salmon red color. Okay, so this color is very, very typical for amyloid. Never ever forget it. Okay, so that was amyloid, which gives you this. Okay, right. Okay. Okay, Satvik. So Satvik is saying rhinosporidia was also given. Okay, so rhinosporidia also I posted a image on the Instagram. It shows you just a spherules with small dots, many small dots inside. That's a very typical image of rhinosporidia. Okay, so it has a big round circles, and that small circles will be given. That's a very typical image for rhinosporidia, which all of you should be knowing. Okay. Right. I think that will be discussed in ENT by Dr. Raji. Right. Okay. So what is the most common cause of hypercoagulability? So whenever we talk about most common cause of hypercoagulability, so this is one of my favorite questions. So most common cause of hypercoagulability is always factor V leading mutation. And for this also, I have told you story so many times, you know. A young person presenting suddenly with stroke, always think of factor V laden mutation. This is one of the most common cause of hypercoagulability in our country. Okay, in our country also, in world also. Okay, that's one of the most common cause of hypercoagulability. Okay, so factor V becomes resistant. Okay, to break down by protein C. That is what is happening in factor V laden mutation. This is also called as activated protein C resistance. So factor V is resistant to protein C. So it is not. So it's not broken down. So this excess factor V causes hypercoagulability, right? This also is a very simple question. Okay, so here it was given a linear immunofluorescence. Whenever they give you a linear immunofluorescence, okay, this is very, very typical of bullous pemphigoid. You know, any pemphigus will give you a fishnet pattern, and dermatitis herpetiformis, only the tips will be showing you the pattern, and usually that is IgA. So bullous pemphigoid is typical linear pattern, right? So there was one more question on amyloid. Sorry, I couldn't get all the options here, guys. I just got that it is deposited extracellularly. That's true. Okay, so it's deposited extracellularly. That's true. This named so because it's similar to amylase, that is starch. That's true. It is beta pleated. Yes, that's also true because it's an abnormal shaped protein. So it was, I think, multiple choice answers, and all these options which I got were true. Right. Okay. Right, guys. So next question was in which case you can give vaccine. Okay, So remember, guys, vaccines can be given in cases of Wiskott-Aldrich syndrome and ataxia-telangiectasia. You cannot give live vaccine to DJOD syndrome. Okay, you cannot give live vaccines to DJOD syndrome. Ataxia-telangiectasia and Wiskott-Aldrich syndrome are cases in which you can give vaccine. Okay. So that was the end of it. That was 29. And the 30th question was JAK-STAT pathway is involved in which hormone? It's leptin. It's involved in leptin. Leptin is the hormone which shows you JAK-STAT pathway involvement, right? So that were the questions that I got, guys. So 30 questions overall in PATH. Some of them are PYQ, some of them were newly asked questions, but they were quite scoring. And I'm sure PATH would have helped you to score well. So all the very best, guys. Seeing off. Goodbye. Any other question if you want to discuss or you want to ask, you can just ask me now.